Seniors and Health warmly welcomes you. In today's Senior Wellness Spotlight, we uncover a story that's more common than you might think. A man followed what he thought was a healthy habit, taking daily supplements without a doctor's input. But what happened next wasn't strength or vitality. Instead, his bones began to weaken silently. No pain, no warning, until it was nearly too late. This quiet danger is affecting thousands of older adults. Let's explore the truth behind this overlooked wellness mistake. Gerald, age 74, had always prided himself on taking care of his health. After retiring from his job as an accountant, he became diligent about taking daily supplements, calcium, vitamin D, magnesium, and a few others he picked up after reading health blogs. He never discussed them with his doctor, believing more was better, and that he was doing the right thing for his bones. But over time, Gerald noticed something odd. His back ached more often, and his posture began to shift. A routine DEXA scan revealed bone loss, not the improvement he had expected. Even more shocking, blood tests showed dangerously high calcium levels, likely caused by oversupplementation. The minerals were building up in his bloodstream rather than helping his bones. "I thought I was strengthening myself," Gerald said quietly, "but I was actually harming the very structure I was trying to protect." His doctor helped him stop all unnecessary supplements and gradually restore balance through a personalized nutrition plan. Today, Gerald shares his story with others at his local senior center. "I wish I'd asked questions earlier," he says. Silence isn't always safety. I'm Dr. Grace Mitchell, a geriatric health expert with over 15 years in senior care. Many seniors don't realize that taking daily supplements without medical guidance can quietly disrupt the body's mineral balance. In Gerald's case, excess calcium built up in his blood, not his bones, leading to weakness instead of strength. I always tell my patients, even good nutrients can cause harm if taken in the wrong amounts. Always test, consult, and personalize before adding any supplement to your routine. Many older adults take daily supplements in hopes of protecting their bones, boosting energy, or filling nutritional gaps. But in the world of senior wellness, more doesn't always mean better. In fact, taking supplements without doctor supervision can lead to serious hidden consequences, especially for bone health. Excess calcium, vitamin D, or other minerals may seem harmless, but when they're not tailored to your body's real needs, they can build up silently and cause more harm than good. Conditions like hypercalcemia, kidney stress, and even bone demineralization can occur gradually, with few or no early symptoms. This episode dives into one man's quiet health decline from unsupervised supplements, and what all seniors can learn from it. We'll explore what went wrong, the warning signs, and the smart steps you can take to ensure your wellness plan helps, not harms, you. Many seniors turn to supplements with good intentions. They read articles, watch commercials, and hear friends recommend certain vitamins, especially calcium and vitamin D for bone strength. Over time, a simple daily pill becomes routine. But what most don't realize is that oversupplementation is a real and growing concern in senior wellness. The problem begins with the idea that more is better. It feels logical: if a little calcium helps bones, more must help more. But the aging body processes nutrients differently. Excess calcium isn't always absorbed into bones. Instead, it can circulate in the bloodstream, building up in soft tissues or even depositing in arteries and kidneys. This is especially dangerous for seniors who also eat fortified foods like cereals, juices, and dairy products, without realizing they're stacking doses throughout the day. When vitamin D levels are also high, it increases calcium absorption even further, pushing the body into a state called hypercalcemia, which quietly weakens bones instead of strengthening them. Early signs may include mild fatigue, body aches, or digestive discomfort, symptoms easily dismissed. Unfortunately, by the time serious changes like bone thinning or fractures appear, the damage has already been quietly progressing for years. The takeaway? Supplements are powerful tools, but they're not neutral. Without testing, tracking, and medical advice, even the right vitamin can become the wrong decision. Unlike acute illnesses that present with sharp pain or fever, supplement-related bone damage is subtle and slow. Seniors may take daily calcium or vitamin D for years, feeling confident they're supporting their bones, when in reality, an internal imbalance is gradually forming. So how does the damage happen? When too much calcium circulates in the bloodstream due to oversupplementation, it can trigger a process called calcium leaching. This paradoxical effect occurs when the body senses an unnatural mineral load and tries to re-regulate by pulling calcium from bones instead of depositing it into them. Over time, this weakens the skeletal structure, ironically increasing fracture risk. The early symptoms are often mistaken for normal aging, minor joint aches, a slightly stooped posture, or frequent fatigue. Most seniors don't connect these signs to their supplement routine. After all, there's no immediate red flag, no dizziness, no sharp pain, just a sense that things aren't quite as strong as they used to be. Compounding the issue is the lack of regular bone density scans, DEXA, or blood calcium level checks. Many older adults assume that if they're not in pain, everything is fine. But by the time a scan shows thinning bones, they've likely lost years of silent strength. Doctors now warn that supplements should never replace clinical monitoring. What feels like preventive care may, without guidance, become slow erosion of the very health seniors are trying to protect. As we age, our bodies become more sensitive, not just to medications, but also to vitamins and minerals. Seniors process nutrients differently than younger adults. Kidney function often declines with age, meaning the body becomes less efficient at filtering out excess calcium or vitamin D. What might be a safe dose at 40 can become risky at 70. Another issue is polypharmacy. Many seniors take multiple prescriptions daily. Some of these drugs, such as thiazide diuretics or antacids, can interfere with calcium metabolism, either increasing absorption or reducing excretion. When paired with daily supplements, this interaction can amplify the risk of toxicity. There's also a psychological factor. Many older adults grew up in a culture that praised vitamins as miracle cures. They may believe that if one supplement is good, two must be better. Combine that mindset with persuasive advertising, and it's easy to see how someone like Gerald ended up taking multiple supplements without question. Living alone can also contribute. Without regular medical check-ins, many seniors self-manage their wellness, relying on old prescriptions, outdated habits, or internet advice rather than updated medical guidance. Over time, this creates a silent, cumulative risk. Unlike medicines, supplements don't always come with strong warnings or routine monitoring. They're often viewed as safe by default. But in seniors, small imbalances can lead to big consequences, particularly in bone health, which declines naturally with age. The result? Seniors are more vulnerable to unintentional harm from the very pills they believe are protecting them. Awareness, blood work, and open communication with a physician are the best safeguards. For years, calcium has been promoted as the magic key to strong bones. But recent research shows that bone health is far more complex, especially for seniors. Relying solely on calcium or vitamin D supplements overlooks the broader picture, and in some cases, creates imbalance instead of protection. Bones are living tissue. They need not only calcium and vitamin D, but also magnesium, vitamin K2, protein, physical stimulation, and hormonal balance. When one piece is overemphasized, like calcium, the system can tilt out of sync. For example, without enough vitamin K2, calcium may deposit in arteries instead of bones, contributing to vascular problems while still leaving bones weak. Physical activity plays a larger role than many realize. Weight-bearing exercises such as walking, dancing, or light resistance training stimulate bone regeneration. Without movement, even perfect nutrition can't maintain bone density. Nutrition also matters beyond supplements. A diet rich in leafy greens, legumes, nuts, and dairy provides synergistic nutrients that support bone health. These foods offer balanced mineral profiles that the body absorbs more efficiently than high-dose pills. Additionally, certain medications, like corticosteroids or proton pump inhibitors, can quietly erode bone over time. Seniors taking these drugs may need specialized guidance, not general advice. The lesson here? Strong bones come from a holistic approach, not a single solution. It's not about megadosing one nutrient, it's about building a lifestyle that supports skeletal strength from every angle. Supplements have a role, but they are only one piece of the puzzle. The real foundation for lasting bone health lies in balance, movement, and intentional daily choices. One of the most overlooked tools in senior wellness is regular screening, especially for those who take daily supplements. Blood tests and bone density scans are not just routine procedures, they are lifelines that reveal what's happening beneath the surface. A basic metabolic panel can detect elevated calcium levels, kidney function issues, and early signs of imbalance. Paired with a 25-hydroxyvitamin D test, seniors can determine whether their vitamin D is within a safe, effective range, typically between 30 to 50 nanograms per milliliter. Levels beyond that don't guarantee better health. In fact, levels consistently above 60 can increase fall risk, not reduce it. Then there's the DEXA scan, a painless test that measures bone mineral density. Seniors over 65, especially those taking bone-related supplements, should have a DEXA scan at least every 2 years, more often if there are symptoms like height loss or fragility fractures. This scan can detect early osteopenia or osteoporosis, often before any symptoms arise. Regular screenings also allow doctors to adjust supplement dosages, identify potential drug interactions, and monitor kidney or liver stress, especially crucial for those on multiple medications. Unfortunately, many seniors skip these checkups, thinking they're unnecessary if they feel fine. But in bone health, the decline is silent. You won't feel a bone thinning until you fall. Making these tests a part of your wellness routine can prevent long-term harm and guide smarter, safer supplement use. Prevention isn't just about what you take, it's about what you track and understand. If supplements are part of your daily routine, don't worry, you don't need to throw them all away. But you do need to rethink how you take them, especially when it comes to protecting your bones and overall senior wellness. It's not about quitting vitamins, it's about using them wisely. The first and most important rule? Never start or adjust a supplement without medical advice. Even seemingly harmless over-the-counter vitamins can interact with medications or build up silently in your body. Ask your doctor for a blood test to check current levels, especially vitamin D, calcium, and magnesium, before deciding what's truly needed. Second, avoid megadoses unless specifically prescribed. Many seniors assume more is better, but excess vitamin D, over 4,000 IU/day, or calcium, over 2,000 mg per day, can lead to kidney stress, arterial calcification, and muscle weakness. The safest dose is usually the lowest effective dose, tailored to your lab results and diet. Third, take supplements with meals, not on an empty stomach. Food improves absorption and reduces the risk of digestive upset. It also allows your body to metabolize nutrients more gradually, mimicking the natural way we absorb minerals from whole foods. Fourth, review your supplement routine every 6 months. What your body needed a year ago may not be what it needs now. Your prescriptions may have changed. Your diet may have improved. Your labs may look different. Lastly, keep a supplement journal, just like you would for medications. Track what you take, how often, and any changes you notice. Being informed puts the power back in your hands. Smart supplementing is not about fear, it's about control, safety, and staying one step ahead. Gerald's journey didn't end with a frightening scan or a warning from his doctor, it began there. At 74, after years of unknowingly oversupplementing with calcium and vitamin D, he faced a painful truth: his bones were weakening, not strengthening. But with the right steps, Gerald took back control of his health, and his story is now inspiring others. The first step was stopping all unnecessary supplements. Under medical supervision, Gerald tapered off the products he'd been taking for years. His doctor ordered new blood work and a DEXA scan to determine what his body actually needed, and what it didn't. Next came dietary changes. Gerald began incorporating more whole foods rich in natural calcium and magnesium, like leafy greens, beans, yogurt, and almonds. Instead of relying on pills, he let his plate become his medicine. Physical therapy was another key part of his recovery. With the help of a specialist, he began balance exercises, light resistance workouts, and posture correction routines. Within months, Gerald noticed more confidence in his steps, fewer muscle aches, and better energy. Perhaps most importantly, Gerald became an advocate. He started speaking at senior wellness groups, sharing his story and encouraging others to get tested, question assumptions, and build a personalized plan with their doctor. "I thought I was doing everything right," Gerald often says. "But when I stopped guessing and started listening, to my body and to professionals, everything changed." His story proves it's never too late to course correct. Even if the damage has already started, healing is always possible when you take the right steps. One of the greatest gifts of aging is wisdom, and with it, the ability to make more intentional choices. For seniors, building a smart, sustainable wellness routine means moving beyond quick fixes and toward habits that nourish the whole body, especially when it comes to supplement use. Start with the foundations: balanced meals, regular movement, and consistent sleep. These three pillars do more for bone and muscle health than any capsule ever could. Instead of chasing isolated nutrients, aim to eat the rainbow: varied fruits, vegetables, healthy fats, and lean proteins. This not only supports bone strength but also improves digestion, mood, and immunity. Next, embrace gentle movement daily. Walking, stretching, yoga, or even simple chair exercises keep your bones stimulated and joints flexible. The body was designed to move, and motion is one of the best defenses against aging's natural effects. When it comes to supplements, think of them as tools, not magic. Use them based on lab results, not advertisements. Keep an updated list of what you take and review it every 6 to 12 months with your doctor or pharmacist. And don't forget the emotional side of wellness. Stress, loneliness, or inactivity can accelerate physical decline just as much as poor nutrition. Stay connected, stay curious, and find moments of joy. Your bones respond to that too. Finally, always ask, is this habit still serving me? Aging is about adapting, not clinging to routines that no longer fit. A flexible mind builds a resilient body. Your senior years can be strong, steady, and vibrant, but only if you lead with knowledge and kindness toward yourself. When supplements are taken without guidance, the damage doesn't come with flashing lights, it comes quietly. Over time, the bones may weaken instead of strengthen. Excess calcium in the bloodstream can lead to kidney stones, arterial stiffness, and even heart rhythm issues. For seniors, this silent erosion often goes unnoticed until the first real fall, fracture, or unexpected hospital visit. The emotional impact is just as real. Many feel betrayed. "I thought I was doing the right thing." But the truth is, good intentions need smart execution. Seniors who oversupplement without testing risk losing not just bone density but confidence, independence, and mobility. A single preventable fracture can start a chain of decline that affects everything, from walking to social life. These are not scare tactics, they are wake-up calls. Your health deserves more than guesswork. It deserves personalized care that evolves with you. I'm Dr. Grace Mitchell, a geriatric health expert with over 15 years in senior care. Many older adults assume that if a supplement is available over the counter, it's always safe. But in reality, your body changes with age, and so does how it absorbs and processes nutrients. Supplements that once helped you may no longer be necessary, or worse, may be silently harming you. My advice is simple: test, tailor, and track. Before starting any vitamin or mineral routine, get a blood test. Know your baseline. Don't guess based on symptoms or trends. What works for your neighbor may not work for you. Next, tailor your approach with your healthcare provider. Discuss what's needed based on your labs, medications, and lifestyle. And once you begin, track your progress. Retest every 6 to 12 months. Adjust if needed. Supplementation isn't about doing more, it's about doing what's right, for your body, at your age. When you stay informed, you stay in control. Your health journey deserves clarity, not confusion. Before adding another pill to your routine, pause, ask the right questions, get the right tests, and make informed choices. You've earned a life of strength, balance, and freedom, not silent decline. At Elderly and Health, we're here to guide you with facts, not fear. Share this video with someone who takes supplements daily. It might open a conversation that saves their strength. Subscribe for more senior wellness insights that truly matter. Your future isn't found in a bottle, it's found in knowledge, movement, and mindful care. Stay wise, stay well. You're never too old to choose better.